cost of healthcare remains one of the biggest impediments to the achievement of universal healthcare coverage for any country, and Zimbabwe is no exception. In the following story, we look at how developing countries like Zimbabwe can leapfrog and achieve the envisaged healthcare coverage by 2030.
Visiting a doctor can be a nightmare for many people in Zimbabwe. The cost of treatment and medicines can be scary, beyond the reach of many. This has resulted in poor health outcomes, especially among people with chronic illnesses such as cancer. Taneta Tirigo lost his battle to a rare blood cancer earlier this year. Prior to his death, ZTN had a chat with him and he shared his struggle to meet medical costs.
Yes, it's a bit challenging, medication, because medication against is a bit expensive, so because
the country has not been spared effects of the global health crisis. This is yet another barrier for people to access health services. Experts are on record calling for increased domestic health funding. Over-reliance on external funding is largely seen as unsustainable in the wake of growing donor fatigue. While increasing domestic health funding remains in discussion, development partners and private players continue to complement government's efforts to achieve universal health coverage by 2030.
We're doing the diagnosis for free. So that means that we're doing the bone marrow aspirations for free, and we're doing the specialized tests that precede the bone marrow aspirations for free within the communities of Zimbabwe. Mainly, we're stationed in 3 provinces out of the 10 provinces in Zimbabwe. The 3 provinces being Harare, Metropolitan Province, Bulawayo Metropolitan Province, and Gweru, Midlands.
But how sustainable is the support from development partners towards the country's health sector?
In 2001, our leaders, that's the presidents, did say that for them to be able to really fight the epidemic, they will devote 15% of their budget to health. Very few countries did that. I'm proud to say that Botswana, my own country, when I was minister, 20% of the budget I got, and that's how come our results have been so spectacular.
Zimbabwe in 2001, together with other African Union member states, pledged to allocate at least 15% of its national budget each year to improving healthcare systems. While the country has made significant strides in improving its healthcare systems, it is yet to meet the target. In its 2023 health budget, the health sector had budget allocation of 11%.
I think it's an example to countries to say, we can have donor funding, definitely we want that, but at the same time, let's have our own resources into the AIDS response, so that when that donor funding dwindles, we'll still be able to take care of our people. So that's where right now I would say the advocacy is to say domestic resources, super. Donor resources also super. Let's combine them and ensure that we have the ultimate response that will eliminate HIV out of our continent.
The newly appointed health minister is committed to address critical needs in the health sector.
For the patients, we also want to see that do they have access to our health facilities? And when they have access to these health facilities, do they get the necessary treatment that they require? Do we have enough drugs? Do we have enough equipment for the investigations?
Affordable healthcare is one of the most basic needs for every citizen. With 2030 fast approaching, serious and quick steps need to be taken now to march towards universal health care. For ZTN Prime, I am Mirera Insingo.